Hello, everyone, and thank you all for joining us during the Lytham Partners Spring 2023 Investor Conference. My name is Ben Shamsian, Vice President of Lytham Partners. Our next presentation comes from Hydreight Technologies, ticker symbol NURS on the Toronto Stock Exchange Venture, HYDT on the OTC, and SO6 on the Frankfurt Exchange. Presenting from the company today is Vahid Shababi, President of Hydrate. A copy of the slide presentation is available on your webcast screen. Today, I have asked the company to briefly run through the slide presentation, and then we will engage in a fireside Q&A session. As a reminder, the company is available for one-on-one virtual meetings. If you have not already signed up, please send me an email at shamsian@lythampartners.com. That's SHAMSIAN@lythampartners.com. or visit lythampartners.com/virtual and click the one-on-one meeting request button. With that said, let me now turn the presentation over to Vahid Shababi, President of Hydrate. Vahid, please proceed.
Thank you, Ben, and thank you everyone for giving us the opportunity today and listening to our presentation. So, in the last decade, we have realized that some of the companies that used to be the big player in their own industry has gone out and been replaced by the companies that adopted their offerings based on the customers' behaviors. Maybe like 20 years ago, if you would have talked about Blockbuster being replaced by another company called Netflix, nobody could have believed you, or Yellow Pages being replaced by Google, or Amazon replacing Sears. The reason for that is the new era requires a new attention and offering, and the way that you offer the same services based on the customers' behaviors. Now, we have realized the same change in the customers' behaviors during the COVID for anything healthcare related. Before COVID, if you would have told someone that your doctor is going to FaceTime you and to do a visit, it would have been hard to believe, or it would have been almost near impossible. Now, the people expecting everything to be done at their convenient at their locations. Now, also, like a lot of analysts believes that the biggest company in the world in the next era will be a consumer health tech company. Now, what is Hydrate? Hydrate is not just an app, it's a movement. Right now in United States, in most states, it's illegal for a nurse to work outside of a brick and mortar or a hospital. Unless they have a medical director to oversee them, they have access to the pharmacy, they are under a friendly PC license, which is a corporate legal structure per state, which you need to have over 30 friendly PC to cover all the 50 states. Now, what the Hydrate is, we have not only we have an app, but also we created this framework and this foundation that nurses can join this network and to start providing the services that they're qualified for at people's homes, offices, hotels, or at their locations. Now, it's a very similar to the Uber and what Uber does for drivers. Uber doesn't own a car, and drivers join Uber to work maybe 1 hour a week, part-time, full-time, or gradually become full-time. That's the exact same thing that the Hydrate does for nurses. Nurses can join the network and use our medical director, our app, our insurance, our friendly PC license to be able to provide their services at the customers and the clients and the patients' locations. That can be an hour a week, a part-time job, or a full-time job. So they have a full control over their schedule, their offering, and the level of the service that they're offering. Now, with the Hydrate, we do have an app that today in the United States, you can go ahead and download and start booking the nurses to provide IV drips or other services. We do have a medical network that our doctors oversee the patients. Sometimes they need to do a telemedicine depending on the rules and regulation of that state. And we also have a 503B pharmacy license, which is a compound pharmacy. And all the orders has to go through our pharmacy. Now, the market size in United States right now, we have over 4.5 million nurses that based on the research that we've done, there are three main points for them. One, they're not happy with the schedule and the number of the hours they're working. They're not happy with the pay, and they're not happy with the level of the service they're offering to their patients. And they like to be on top of their schedule, their offering, and the way that they offer the service, which Hydrate is the solution for them. For Hydrate, we have 4 different revenue streams. One is every nurse, in order to be part of the network, they pay an annual licensing fee, on average $4,000 a year. Then when they get booked through our app, we take 10% of the fees as the Hydrate portion from those fees. In order for them to be covered under our friendly PC licenses and insurance, they have to make the order to our pharmacy for those services. And we do have an average 30 to 35% margin on our pharmacy orders. Now, creating that network and that pharmacy has made the offering very lucrative for a lot of brick and mortars and franchises that they like to white label what we have and use it under their brand, that they're going to get the tech, they're going to get our pharmacy, and they'll start doing it for their own network, but we still make money from the pharmacy and the booking. Now, if a nurse joins us, as I went over the different revenue streams, they're going to pay us $4,000 as a subscription fee, 10% of the gross booking from the sales, and then on the pharmacy sales. Again, the pharmacy sales is anywhere between 20% to 40%, depending if you take over the inventory or not, but 20 to 30 is the safe side for margin side. And under that, we get access to our medical director, to liability insurance, the 503B pharmacy, and so forth and so on. Now, if you look at the numbers of Hydrate, in 2021, the company had a top-line revenue of $1.7 million. 2022, we finished with 6.6 million top line revenue. And this year we're on track for 16.5 million revenue. Same thing when you look at the number of the new business partners that they joined us. 2021, we had 102 business partners that joined our network. In 2022, over 700 people joined our network. And this year we're aiming for 1,500. And we're on track to have those numbers met in 2023. We have filed our year end for 2022, end of April, and we're filing our 2023 Q1 numbers at end of May. And when you look at our, again, from the revenue recognition side that is going to be in our financials, we also had over 200% growth on our numbers as well. So when you look at the numbers for Hydrate, it's a business that has been generating revenue in the last 3 years. And the numbers that we're looking at for this year is on the conservative side of it in compared to the growth that we have realized in last 2 years. Now, we do have some catalysts that are coming for the business. Obviously, the business was listed in December. Because our offerings right now is in United States, we had to wait for our OTC listing and DTC eligibility that we got it in late Q1 2023. Now we're starting, slowly introducing this to the market with some IR activities to get some eyeballs. Alongside of that, we're working on 3 acquisitions that each is going to add about 15 to 20 million revenue to our top line, and also is going to give us access to more nurses that they're coming on board and add a new revenue stream for us. We're adding more offering to our catalogs and basically to our pharmacy. We're adding the lab tests that now people can be at home, and our nurses is gonna go to their locations to do their blood test, and also static by adding fillers and everything around that. We're adding a medical dispatch that are the users, they don't have to only download the app, but they can also call a number and a registered nurse will answer the phone call and start booking them for the nearest nurse and answer their questions. We're starting a Hydrate University and Training Center for our own business partners and nurses that they can improve in every end to increase their sales and revenue and their skill sets, adding more products, adding more white label clients, and also going to the different countries to add this. Our main focus right now is in the United States, because as I mentioned, there's 4.5 million nurses in the United States that can be joining our network. But we created that framework, and it's just a plugin to go to other countries that we need to have a medical network, a pharmacy, and then a legal firm that to make sure we're going to be within the rules and regulation for those countries. And the top 4 countries that we have some conversations with different contacts in those countries are Canada, UK, Greece, and Brazil, that they are the next potential destinations for Hydrate. When we look at the market in general right now, the EV to revenue is roughly about 25, 26 times of the revenue. And right now, the Hydreight Technology is about 4 times. And if we go with the median or mean of that, which is about 15 times, and this year, we're projecting 16.5 million US, which is roughly going to about 22 million Canadian. That is going to give us the market cap that we're expecting to be in this year, and is going to be the value for the business. And we've been trading at the very discounted rate right now, based on our trades at this time. We have some key players and key partners in the market that is helping us in different area, from the pharmaceutical products, from the network, from helping us to get to the different countries. And again, we're very proud of the movement that we've created beyond the product, beyond the app, that we're helping many nurses to actually enjoy their lives, and they have the full control over their schedule and their offering, and have the life that they deserve. The outstanding shares, it's a very tight structure. The outstanding shares right now is only over 37 million outstanding shares. The current share price is around 60 cents Canadian on TSXV, with the market cap around 20 million, which is very discounted based on the revenue and the multiples that we're seeing in the market. And there is about over 70% insider ownership within the company, and the cash position is over $2 million for a business. If you are in the United States, I encourage you and I invite you to download our app from the App Store and try the Hydrate service and see that and see what we're offering, and have a conversation with our nurses. Once again, I really appreciate your time and giving us the chance to present and listening to our presentation. If there is any further question, I'll be more than happy to answer, or you can email me or Shane, the CEO of the company.
All right, thank you, Vai, for that overview. Wanted to delve in on some topics here at detail. Let's dive into the infrastructure that you've built, the legal framework, the overseeing physician, the various laws and regularities which you have to comply by. Why are these important? Why are they complex? And help us get an appreciation of what you've built from that standpoint.
Absolutely. So if we go back 2.5 years ago, during the pandemic, they relaxed many of the rules and regulations for telemedicine and telehealth. Now, they started cracking down into it and making it tighter for all the good reasons, because we're talking about the people's safety and health. Now, creating those, it's not when you're talking about United States, you're talking about 50 different countries that each has its own pharmacy board, their own medical board, and nursing board. And each has their own flow for different offerings that has to be done. And as simple as the flow of the money, all the way to the flow of how the medical director or doctor has to oversee a nurse, to how to be prescribed, how to receive the medications and pharmaceutical needs, and all the way to how it will be done on the patients. So creating that, it's not an overnight thing. You have to, number one, has the full visibility to all the legislation and upcoming legislation for all those three boards. Then you have to go ahead and have a technology to be able to be customized based on the product, based on different characteristics of the patient's age and many other criteria there, and also based on the service they're getting. So number one, knowing those. Number two, having a proper medical team that you can serve your clients from early morning to late night, depending on what they're doing, and then have the right people to be on top of that and have a technology that can be customized based on all those criteria. It makes the barrier to entry very hard for other companies to do what we're doing. Now, because some of these rules and regulations were relaxed, we saw some of the companies came and focus in one thing. For example, like having only IV drips for the nurses that they're hiring. And now we see some of those are closing shops for state by state because they cannot be compliant with the latest regulations that is getting tougher. So creating that infrastructure, it makes us our position very unique in the market, that we can be flexible and follow the latest rules and regulations on any of those boards.
Got it. Thank you. Let's talk about the nurses. There's a slide there where you talked about sort of their income on their sort of regular job versus what they can do here. What are you seeing in terms of nurses coming on part-time, going full-time? How are the sort of per hours salaries different? Give us some insight into why it's interesting for the nurses to be involved here.
That's a very good question, but that number varies because, as I mentioned earlier, very similar to the Uber, we have nurses that they come on board for simply do one event a month. And one event is sometimes there's an event that they get invited and they just do a bunch of IV drips, for example. We have nurses like Anita or many other nurses that we have that they quit their job and they're doing this as a full-time basis. Right now, we have a nurse that they made their subscription within a day based on their offering. So it very varies based on how many hours they work, based on the type of the different services that they're offering and the products they're offering, and three, the states or the city they're at. Now, we see one common difficulty across the board with our nurses, that they're really good in offering what they're offering, but not all of them are good business-minded people in a way that they can grow their business and scale their business from the marketing perspective and sales perspective. So that's one of the initiatives that we're taking, that we're starting a brand new website and channel that we're going to start promoting it to the consumers, and the consumers is going to have to get this information, they get educated, and if there's any question, there will be a phone number or a chat that they can call our dispatch, and a full-time nurse is going to answer their question and they're going to book our nurses, based on the patients and the clients' needs, to help them with the marketing efforts as well. So to answer to your questions, it very varies depending on the purpose and the amount of the time and locations and the offerings that each nurse is putting up. But we have nurses that they cover their subscription within a day with their offerings. And again, they quit their full-time job and they're just focusing on Hydrate and growing their business.
Got it. So this brings me to sort of, you talk about loosely a B2B side and a B2C side of the business. Help us sort of understand the differentiation there and with some examples, if you could.
So right now, Hydrate is a platform and is a network that we're focusing only on nurses or even the brick and mortars that they want to have offering mobile. And we don't focus on bringing them customers. Obviously, because they have to book and they have to do all the consent form and everything on our app, we see the consumers on our app is growing very fast. And sometimes we see, a customer that originally downloaded our app because they wanted to get a service in Vegas. Now they book us in Scottsdale and they book us in New York, and they're moving from one city to the other city. So that's our primary focus, and the phase one for our business, which was last year and up to Q2 this year, is focusing on getting more providers on the app, because we knew the fact that if we get consumers and there are not enough providers, they're probably not going to give it a second chance to the app. So our main focus was bringing the providers, which last year, 2 years ago in 2021, we signed up over 100. In 2022, we signed up over 700 new business partners or providers. And this year, we're aiming for 1,500 and bring them on board. Now, that numbers will change and increase dramatically if we do those acquisitions, because we're going to have access to a group of nurses now. Now, the second project that is the dispatch project. Now we're also focusing on getting the consumers and customers directly on our app that provide them to our business partners and providers to take advantage of our services.
Got it. Okay. You talked about the 4 revenue streams. Can you walk us through sort of just a live example of how that works, right?
Absolutely.
Customer goes on, just walk us through a live example of how that ends up.
So the first 3 is going to be under the Hydrate brand as an app, which a nurse or a business partner or providers come on board with us. They pay $4,000 upfront as the first year subscriptions, and every year they're going to get they're going to have to pay $4,000. Then they start getting booked through Hydrate app. When they get booked, if let's say they're getting booked for an IV drip, which costs $250, Hydrate takes $25 of that as the 10%, which is our commission from the gross sales. In order for that business provider or business partner or nurse to provide that IV drip booking, they need to order from our pharmacy to have everything that they need in order to provide that service. And they have to order from Hydreight Pharmacy, which our margin is between 20 to 40%, depending on the level of the service and type of the service. And we also take that portion as well. So those are the 3 revenue streams. Now, the model is a very lucrative and easy model that is not easy to replicate. So we see some franchises that they have few hundred locations come on board, and they want to use our system end to end from the tech, from the pharmacy, but they want it to be skinned under their name, so they have their own network because they already have enough locations. So we provide that as a white label to them, so they can offer a similar thing within their network, and we still take a percentage from their booking. We still charge them for a licensing fee per year, and we also take an advantage of the margin that we have in our pharmacy and the pharmacy orders that they put in place.
Okay, great. The numbers that you've put up so far have been very good, and the projections are stellar. What gives you confidence in sort of getting to those projections? We're sort of middle of May now. You probably have a good sense of where things are going to go towards the end of the year. So help us understand what gives you comfort with those projection numbers.
So I always look back and learn from what we could have done better and implement it for future. So when we look at the trend that we have in 2021 to 2022 and 2022 to the end of the year and 2023, we see that pattern. So right now, the company we're getting our name out there and our kind of like a blueprint in the nursing and the healthcare industry. Now, we see the numbers that they're coming on board. We're on track for those numbers based on our Q1, that again, the numbers will be released by end of May. And now, again, those are only organic growth. We're not considering any of the acquisitions that we have in place. So when I look at the past, it gives me a benchmark on many of the conversions that we have from the spending on the pharmacy, from the booking per customer, from the number of the nurses that they're coming on board, cost per lead, cost per customers, and other variables, that it leads us to this year numbers in a very conservative manner, that we're hitting those, and we see the trend that we're expecting is actually very conservative. Because when you look at the numbers that we have for this year, the biggest weight was on Q3 and Q4. However, Q1 numbers has already beat the numbers that we're expecting to get to the numbers that we're sharing right now. And we're moving forward with the same pace to make sure to do our best to get to those projections that we're on track on.
All right. Well, Vahid, thank you very much for your time today. We really appreciate it. To anyone out there who's not already signed up for a one-on-one, again, please send me an email at shamsian@lythampartners.com, SHAMSIAN@lythampartners.com, or again, visit lythampartners.com/virtual and click the one-on-one meeting request button. And with that, we all hope you have a good rest of the day. Thank you.
Thank you.